One of the most common types of plastic surgery that's performed is rhinoplasty. Today we're joined by plastic and reconstructive surgeon Dr. Kailash Narasimhan, and we're going to talk about the procedure and just, how the effect can be more than just cosmetic for a lot of people.
Right.
First of all, most of us refer to this as a nose job, but why is rhinoplasty so common?
I think it's common for a couple of reasons. Certainly when you look at yourself, the first thing you see is the nose, and for both functional and cosmetic reasons, it can be a very satisfying procedure. Number one, for patients that may want to change the appearance on the outside of their nose, but also for patients that want to breathe better, particularly patients with deviated septums or irregularities on the top of their nose that may need some correction.
Wow, so it can be more than cosmetic for some folks.
Absolutely.
Okay. Who are the best candidates for the surgery?
Good candidates typically are evaluated and they're shown to have some kind of anatomic abnormality. Usually it's an exam inside the nose to look at the septum as well as some other structures. Also, patients need to be realistic and have expectations right about the recovery time involved with rhinoplasty. But again, a skilled surgeon is someone that needs to look at all those factors and take them into account.
What is the recovery time? You just mentioned that for this kind of surgery.
So typically, patients have a lot of swelling on the initial stage, especially if the bones are repositioned and they have a nasal splint on top of their nose for about a week. But the period of healing can last anywhere from 6 months to a year. There's a lot of swelling initially, but then it gradually subsides. So the initial appearance of the nose right after the surgery may not be what it looks like in a year, but eventually when the swelling goes down, that's about the time period. We usually say about a year.
Okay. What can a patient expect during that surgery?
During the surgery, typically it's done under either a general anesthesia or a little bit of twilight sedation. Usually the surgery is an outpatient procedure. It takes anywhere from 2 to 3 hours, sometimes a little bit more depending, and patients typically go home the same day.
Wow. Okay. All right. Good information, Dr. Narasimhan. Thank you for joining us today.
Thank you for having me.
All right. We'll be back after the break.